One option that plenty of people want but is almost certainly not on the table is insurance for everyone, no matter who. For fact's sake, I take a look at how universal health care is possible, and we're not just talking single payer. 58 countries around the globe have universal health care systems, and 34 of 35 developed countries in the world offer some form of universal coverage. All of them except for one, the United States. Here's how universal systems work. There's a mandate that every person must have insurance that covers basic health services. That pools the financial risk of health coverage across the entire population, which brings down costs for all. On average, spending per person on medical care is 60% lower in developed countries with universal systems than it is in the United States. The insurance is paid for through some combination of premiums and taxes. Those payments help subsidize coverage for the people who can't afford it. Now, that's very different from the current American health system, where thousands of different parties, some private, some public, and some individual, chip in a bit, while millions of people still go without insurance because it's too costly. Calls for a universal system in the United States go back decades, but all attempts so far have failed. Still, new polling by Pew suggests that 60% of Americans think the federal government should be responsible for guaranteeing health care for all. Critics of universal health systems point to higher taxes and longer wait times for doctors because they often prioritize urgent cases. But the U.S. can have long waits, too, more often than not because insurance companies are trying to save money. Meanwhile, health premiums continue to rise. No health system is perfect, but one that gives coverage to all may still have its day. Today on the docket, Alzheimer's disease. Alzheimer's is remarkably common. Over 5 million Americans currently live with Alzheimer's. Someone new develops it every 66 seconds. This is the sixth leading cause of death in America. 1 out of every 3 seniors in America dies with Alzheimer's or a similar form of dementia. Now, as you can imagine, treatment of Alzheimer's, like the other diseases that I've been talking to you about here, is costly. $259 billion is spent in treatment each year. 68% of this comes from Medicaid or Medicare. That's why this is such an important part of this discussion. The cost of treatment isn't exclusively monetary either. Last year, more than 15 million Americans contributed to the more than 18 billion hours, get this, of unpaid care to individuals who are affected by Alzheimer's and other forms of dementia. So this is a really important part of this. If you have someone in your family or close to you who has Alzheimer's or dementia, there's a lot of stuff that isn't about money and paid help. It involves a lot of people. It is easy to get lost in the numbers of this disease, but there are real people behind these figures, both patients and their family. To give us a closer perspective on Alzheimer's, I want to bring in Deborah Kahn. She's the executive editor and founder of something called Being Patient. Deborah, thanks for being with us. You wrote an article aimed at Republican senators recently, and you have a striking story in it about a woman whose husband was diagnosed with Alzheimer's at the age of 55, and the ridiculous journey that she's going through to try and qualify for Medicaid benefits to help with the treatment. Tell me about this. Tell me how these Medicaid cuts are going to have an impact on both treatment and the caregivers.
Susan Ellis was the woman who I mentioned in my op-ed. She was one of the many people who wrote to us when we went out and we said, what is it that you need to know most? What type of information do you need on Alzheimer's disease? We were really surprised about the number of people who wrote to us over anguish against the U.S. healthcare systems, sharing their experiences of what they went through. Susan being one example, she was someone who has been married to her husband, Frank, 19 years. He was diagnosed with early onset Alzheimer's disease at the age of 55 last spring, the spring of 2016. He took an extraordinarily rapid decline and needed full-time care a year later. Susan had no other option but to quit her own job. She wanted to take care of Frank inside their own home. She went to Medicare and said, I need help. I need funding to help me with his care inside the home. What happened was she was told, well, actually, I'm sorry, you're too wealthy for us to provide you with Medicare. Frank had an IRA. She was told to spend down his IRA.
At the age of 55.
At the age of 55. They went from a 2-income household to a 0-income household, and being told they really have too much money to be provided with any of the year.
I think the point you make is very valid. Two-income homes can become 0-income homes, because if somebody in your house has Alzheimer's, it's so difficult to navigate that you may have to leave your job to deal with it. Deborah, thanks for joining us. I really appreciate it. Deborah Kahn is the founder and executive editor of Being Patient.